Hey, hi there. Thanks for joining us. This week is World Breastfeeding Week. Joining us live to talk more about the benefits of breastfeeding is Barb Donnelly. She is a certified lactation consultant at St. Peter's Hospital. Hi there, Barb. How are you?
Good, Courtney. How are you doing?
Good. Thanks for joining us today. In honor of this year's theme, which is Support Breastfeeding for a Healthier Planet, can you talk a bit about the connection between breastfeeding and the environment?
Right. So, well, these days we're always talking about eating local and locally sourced food, and we've come to appreciate what that means, fresh and lower imprint on the environment in terms of fossil fuel emissions with transportation and moving food from one end of the country or even one end of the world to another. And nothing's more locally sourced than breast milk. So, but certainly, and it is we know the best food for infants, and infant formula does have a huge impact. The production of it, it's tied to the dairy industry. There's deforestation that happens to support that type of farming, and again, the impact with the release of fossil fuels with moving that product all over the world. And so with breastfeeding, there is really none of that, much lower impact. And there's less waste, certainly, because, we're disposing of plastic bottles and containers and artificial nipples. And so there's so much less waste, not zero, but less waste related to breastfeeding.
Yeah, absolutely. Breastfeeding while natural isn't always easy, especially any mom who's watching,
Right.
I guarantee a number of us, have had problems along the way. What are some of the most common challenges that a new mother faces when it comes to learning how to nurse?
Yeah, well, they can start right in the hospital, of course, with recovering from delivery, and then, oh my God, I got to get right to work with learning how to feed this baby. And because a lot of us didn't grow up in a breastfeeding culture necessarily, we can really be starting from scratch. And that's, of course, why I and my colleagues and friends have jobs in lactation, because moms often need a lot of help and support. So those challenges can range from the most fundamental, which is getting that really good, effective latch so mom is comfortable and not in pain, and baby is most effectively getting that milk from the breast. And that's the initial challenge, and that can continue for the first few weeks, and for some mothers the first couple of months. Challenges around family and friends support. All the studies say that if a mom has good support from her partner, from her family, she's much more likely to be successful in meeting her breastfeeding goals. And certainly the challenges around back to work, even if it's working from home in this environment, can kind of fill a mom's head with a lot of worry and concern about how that's all going to piece together.
Sure. You talk a lot about you talk about support and how important that is. Are you seeing a change in the family dynamic where years ago formula was kind of the norm? Are you seeing those, especially the older family members, really start to become more educated and more supportive of breastfeeding?
I think so. I think that the public health message has built some steam and momentum, and back when we were getting more visitors at the hospital, I would frequently hear from the baby's grandmothers or aunties, and who would say things like, oh gosh, we never had any of this kind of support. Nobody came in to help me, or we didn't even really know about breastfeeding. We just gave them bottles. And they can be very interested in it because I think they have come to understand. Now, that's not to say though that there isn't some challenges, for moms who are hearing, oh, let me give you a break and I'll just give the baby a bottle of formula. Sure. And not knowing that there's, because God knows we all love to feed a baby, but there's other wonderful ways to assist a new mother that don't involve taking her baby away to pop a bottle in his or her mouth.
Yeah. The world, switching topics a little bit, the World Health Organization is calling on governments to protect and promote women's access to skilled breastfeeding counseling. Why is this so critical?
Yeah, well, it is really critical for a couple of reasons. Because we we do and have lived in a very sort of transient world now, people moving. The help traditionally that women got for breastfeeding was from their mothers and sisters and aunties who had breastfed, and so sort of passing along that knowledge. And many women don't live in that sort of setup where they have family members close and maybe didn't have family members who breastfed. So, so it falls to the rest of us, as you know, in healthcare, with nursing staff and lactation staff, right in the hospital, pediatricians, offering support, quality information, encouragement, right from the get-go, even prenatally, even before women become pregnant, to start that process of education and support. And it is critical because it's a relationship and it's also a skill set. And so we kind of have to approach it from two places to help a mom. And so getting that skilled support is really important, because we don't come into this world as young as girls and then become women and just intuitively know how to breastfeed. It doesn't really necessarily work that way. Some moms and babies kind of fall into place really nicely, quickly. But again, that's why I have a job. Most moms and babies need time and help to build that skill set and build that breastfeeding relationship.
So in your role, I mean, so if a woman is pregnant and considering breastfeeding, I'm assuming she starts that dialogue with her provider, and then once she delivers, what happens then? How does your role, influence her stay?
Well, it's been really tricky right now during COVID, because the moms and families are moving through the hospital setting quickly, because most families want to just get back home. They prefer not to be in a hospital setting for longer than necessary. So we've sort of hit the accelerator on trying to get moms, the support they need as quickly and as efficiently as we possibly can, with some limited staffing at times based during the pandemic, and things are starting to improve now. But our labor and delivery nurses are wonderful in terms of helping that mother who wants to breastfeed get that first latch, give her some of that very most basic teaching, because we can't absorb a lot of information, a couple of minutes after we just had a baby, but help with some of that hold in position, getting that baby, that first feeding. And then as they come into the postpartum, excuse me, to help them to, that's when the nurses, the postpartum nurses, the NICU nurses even, and the lactation staff, and hopefully with the support of pediatricians, kind of jump in to help arm that mom and family, and partner as well, for when they get home, to know kind of what the process is, to have some sense of what to expect, and to recognize, I think I might need a little bit of help here. And so we try to at least do that in anticipatory guidance, since they're not with us for long, to know what they're looking for and to know what their resources are once they get home.
And I mean, I remember when, I delivered at St. Peter's Hospital, upon discharge, and I was having, some breastfeeding issues. I was able to call and still ask for help. And I'm assuming those services are still available.
They are, and we have gotten good on the phone, because for right now we're not able to meet with mothers with support groups or for one-on-one assistance with an outpatient consult. But we do still strongly encourage mothers and their partners to call us sooner rather than later if they're experiencing any difficulties, or just think something doesn't quite seem right, or they just want to check in and make sure they're heading in the right direction. And so we do still take those calls and encourage. We give our cards and we say, please call us. but along with that, letting them know what other resources there are once they get home. For example, the Greenbush La Leche League is doing virtual meetings. So that's a really great resource. Now, is it ideal? No, maybe not, but I think we're all adapting as quickly as we can to support you know, mothers and babies and families as best we can, until in some way we can come back together for in-person support. But yes, we absolutely are doing everything we can to support over the phone.
And I know, you know, the baby cafes with, you know, which St. Peter's Health Partners, you know, sponsors, you know, a few in the capital region, they are also doing virtual sessions to help mothers, you know, connect, you know, just connect with other mothers and to ask questions too, which I know has been very helpful. And one thing you mentioned is COVID. You know, I'm sure a big question that a lot of, you know, expectant moms might be asking is, you know, how will COVID affect my breastfeeding goals? Is it safe to nurse if you think you have been exposed to the virus, or maybe if you're sick? What is the latest research saying about this right now?
Yeah, and that has been, you know, we sort of started in what we've all been moving really quickly, starting in one place and evolving to the next. And certainly the health and safety of mothers and newborns that's what we do. That's our job. And that's the most important thing. And in the lactation department, we've always said breastfeeding and mothers and babies staying together has to be a part of that. And thankfully the research has sort of borne out. Now it's not complete because this is a novel virus. It's only been 6 months. But the best research right now is telling us that for a mother who is either COVID positive or is a person under investigation, meaning she may have some concerns of a very recent exposure, maybe right before she came in to deliver, she does not have to be separated from her newborn, thankfully, unless that is her choice, unless she is so anxious about any potential for infection that she requests that. But except under those circumstances, the mothers who want to breastfeed are encouraged to do so. Now, certainly we have some protocols in place with, you know, meticulous hand hygiene. The mother is, of course, always masked and hand hygiene before she handles her baby. And then the baby is brought to her for feeding and that skin-to-skin time during feeding, and then, you know, moved sort of across the room for that sort of social distancing with the support person across the room. And thankfully our rooms do allow for that. So yes, we have, but we do encourage any expectant parents to continue their social distancing and mask wearing. And it's difficult in the summer. It's difficult when a lot of mothers have to let go of their ideas about showers and family celebrations to welcome the baby. But most of our patients don't seem to have a problem with that, because, you know, when you find out you're having a baby, moms just want to make sure that they're doing everything they can to keep themselves healthy and keep their babies safe. So most of our patients are telling me they haven't been doing a whole heck of a lot, but they're okay with that.
Good. Oh, and hopefully we'll get past this at some point soon.
Yeah.
Barb, thank you so much for taking the time to, you know, talk with us. You know, we'll definitely post some links on our Facebook page for anybody else who might have other questions. And thank you so much. Really important information.
Wonderful. Thank you so much, Courtney.
You're welcome. Have a great day.
You too.
Thanks.